Hey everyone, welcome to my YouTube channel. My name's Luke, I'm 25 years old, and I'm making this video to explain why I have this tube running up through my nose. Basically, 3 months ago I was diagnosed with a very rare stomach condition called Sma Syndrome. It's short for Superior Mesenteric Artery Syndrome, and basically the third part of my duodenum is getting pinched off between two arteries, and they believe it was caused by like a loss of fat, and that fat, when it decreased, it like pinched the small intestines shut. But even though I was diagnosed with it 3 months ago, I've been having problems with it for the past 7 months, and it has been such a battle. This has been one of the most difficult and challenging, but also one of the best years of my life as well. And I guess I'll explain that later on, but for now, I'm going to explain how it started, what I've gone through, where I'm at now, just to help inform people about it. And if anyone else has the condition or knows someone with the condition, please comment below and just let me know a little bit about your story, because apparently it's very rare, and I do quite a bit of research on it, and there's only a couple videos that I've found about the syndrome and the condition, so any information you have is greatly appreciated. So this all started 7 months ago in early March. I was getting stabbing pains in my stomach. I didn't know what was causing it. It just got to the point where at night I was getting such stabbing pains, pretty much between my belly button and rib cage over here, in the my like left side, pretty much the upper part, not like the chest, but like over here. And I was getting these stabbing pains. It got to the point where it was so bad that I was going to the ER pretty much, well, intermittently. I went probably 7 times over the period between like March and June, because I would go to the ER. They wouldn't know what to do. They'd run a couple tests, they'd do blood work, and they'd pretty much send me on my way and tell me to go to the GI doctor and get it clinically correlated with something. And during that time, it was so frustrating. I had no appetite. Even though I wanted to eat and I was hungry, no matter what I ate, it would really upset my stomach. And it took me a while to figure out what certain foods set it off, and mainly fatty and fried foods would just make my stomach go crazy. So at first they thought it was maybe gallbladder problems, maybe something with the bile ducts. And about late March, the pain was so bad, I was in the ER, they admitted me and they did endoscopy, and they found gastritis with possible biliary colic and sludge, and basically they couldn't really do much about it. They put me on like a proton pump inhibitor, they put me on Carafate, and they thought the condition would just resolve on its own. And during that time they had no idea it was Sma syndrome, so it was just trips to the ER, trips to the GI doctor, trying to figure out what was going on. And it took about 2 endoscopies, 1 colonoscopy, an MRI, and finally an MR enterography, which found the pinching. And that was a big relief to finally get to the root of the problem. And they found that, I believe, late June. And then they did a second push endoscopy mid-July to confirm that's what it was. And since then, they've been working on treating it. The steps they decided to take, my doctors, was to try this nasal feeding tube to help build up the fat. And their goal would be, once that fat builds up all the way, it should stop the pinching. And I lost, because I wasn't able to eat, I was normally at 145 pounds. And within a month, I lost at least 20 pounds. And at my lowest point, before they put the tube in, I was around 115. So there was just a huge amount of weight loss. And was just challenging because when you can't eat, you don't have any energy. It's just really rough. But so far, it's early October. I've had the tube in for about a month. I've gone from 115 pounds to 131 point something.
Comes from Luke.
Earlier this morning. So it's good. I'm making progress. I want to thank everyone for their support. Whether it's just, just talking or being cool with the tube. I get the funniest looks. Seriously, everybody looks. Everybody. And I don't blame them. I would look too. Because, it's a tube going up my nose. But I have some really funny stories. Like, I'll be driving and people will be staring at me. And this one guy was looking at me. He was in the left turn lane. And he was just staring at me. And I'm seeing that his light's green, so I can see that he's looking at me at the corner of my eye, so I'm not making eye contact. But after a few seconds when his light was green and tapped on the window, I was like, pointed at his light, I was like, come on. And he's like, oh, whoa. And then he went. But, bunch of funny stories. And, one of the things that's really helped me through this, whole ordeal is staying positive. And the tipping point for me was when they decided the next step would be to put the tube in. I was getting really sad and down. I was like, why is this happening to me? But at that point, I just decided, I'm not going to get down on myself for it. I'm going to stay positive. And that has really been one of the tipping points to help me get through this all. Because I was having so much anxiety and minor depression when they couldn't figure out what was wrong. I was up all night. I couldn't fall asleep because the pain was so bad. And thankfully all that's managed. And that's been going well. So this tube has been in for a month. They're going to check it again. I've been pretty much getting it checked out every 2 weeks, making sure the tube's good, making sure my weight's good. The next step is to do another MR enterography. I have to schedule it. I just got the order today, so I'll probably schedule it. It usually takes about a month with the insurance to get pre-approved and then just to get it done through the hospital. So yeah, that'll be the next step. I'll do another update video then. If you have any questions, don't hesitate to ask in the comments or shoot me a message, and I'll be more than happy to answer any questions or just talk about the syndrome. Thanks a lot for watching, and have a great day.
He left this message.
About 3 months ago, I was diagnosed with something called Sma Syndrome, Superior Mesenteric Artery Syndrome, where the third part of my duodenum is getting pinched off by 2 arteries. And it's caused a lot of problems, a lot of weight loss. And all these symptoms started about 7 months ago, and I was diagnosed with it about 3 months ago. So they're kind of getting onto the situation of what's going on. So I was just wondering if you had any input or if you've seen it before. I really appreciate any information you have. Thanks a lot.
Dr. Donut?
Superior mesenteric artery syndrome is a very rare condition. I think I've probably only seen it twice, maybe 3 times in my 15 or 20-year career. And it is, as Luke describes, it's where the first part of the small bowel, which is the duodenum, passes between 2 arteries, which it normally does. But in some cases, those arteries really come close to the duodenum or the small bowel and pinch it off, so it causes a blockage, which causes a lot of symptoms: pain after eating, nausea, feeling full very fast, vomiting, reflux-type symptoms. And it's not surprising that it took a number of months to find it because it is such a rare condition, and we can see it with X-rays and CT scans once we start suspecting it. And the initial treatment usually is a more conservative, trying to get their nutrition back up, because part of the reason why people get this blockage is sometimes because they've lost, they're supposed to be fat or on the small bowel between those 2 arteries. And if you've had rapid weight loss from illness or psychiatric issues or bariatric surgery and you lose that fat, then those 2 arteries get really close to the duodenum and pinch it off. So trying to get people to gain weight so that they're more healthy to begin with, even if they need surgery, is helpful. And sometimes you gain enough weight and get enough nutrition back, that fat in that area starts reaccumulating and then opens up the duodenum and people are able to continue. But most people end up needing some sort of surgery to correct that abnormality so that the pinching is relieved so the food can pass from the stomach into the small bowel and down further.
So, according to his question, it can, in so many words, be cured.
Right. It can be. With surgery, a lot of patients get good results for sure. Some people still have some issues because if you go in and do surgery, it sometimes affects the anatomy of the area and you get scar tissue and other problems. But definitely, most patients get some, if not total relief from surgery.
How do you diagnose SMA syndrome if it's so rare?
The first thing to do is to diagnose it with X-rays, where you do X-rays with barium in them so they can see that right past the stomach there's a blockage where the food and fluids are not going past it. And when we see that, then usually we do a CT scan angiogram, which will look at the blood vessels as well as the small bowel anatomy, and that gives a clearer picture of that region.